Welcome back to Shaw Spotlight. I'm here with Dr. Kennedy. Dr. Kennedy, it's been a few weeks since we spoke. How are things at the hospital?
Oh, yes, Janice, good seeing you again. And certainly we're in excellent condition at the hospital. We have no COVID-19 cases in the hospital. We haven't had a case for over a month. As you know, in the community, there's only 102 cases, and right now, as of this afternoon, no active cases. So from our perspective, the community has done very, very well. I just like to remind the community, though, I still would, at all costs, avoid travel to the United States. We did have a recent event that someone had returned, and they were positive. So it's and it puts the community at risk. But some people have to go to the States for family reasons. They have property there. But I would just say if you ever have to travel to the States through family or required need, just make sure you really take all those precautions when you're there. As you know, travel is restricted. They have to quarantine when you come back, but there's still some people are crossing the border for business or other areas. Just make sure you take all precautions because that's our biggest risk at this point in time.
Now, the mandatory masks have been in effect for a couple of weeks. Do you think that has a lot to do with how well we're doing?
Absolutely. The evidence is really clear. If you can't keep that 2-meter distance, that cloth mask, surgical mask, certainly provide sort of a protection, for that 6 feet of droplet contamination. So I think a mandatory mask has started here in the hospital and then has expanded to the city through public health recommendations is an excellent recommendation. And I think we got to keep that going indefinitely. COVID-19 is here to stay for a good number of years, I believe. We'll need to learn how to live with COVID-19 over the next, several months to years, and we'll learn more as we go on. You need to look at the prevalence of disease in the community. So right now, we're very fortunate being isolated in Northwestern Ontario that we don't have any active cases. And that's why I'm comfortable with children returning to school. Parents have to make their own decisions. It's very stressful for all of us with the return to school, the children, the parents, and even the employer, because if the children are sent home with symptoms, and many children have a sort of a sore throat, runny nose, they're going to be sent home, and the sort of parents will need to go home and take care of their child, and it will have a definite impact on employers here all throughout the city. So I just urge the managers best they can to understand the unpredictability of students returning to school and the need to be flexible with their employees when they can.
Now, with everyone being so safe with COVID, with masks, with hand washing, with distancing, I would hope that things like the common cold and the flu would not be as prevalent this year. Do you think that will happen?
Absolutely. We've seen that already. I mean, there's through our emergency department, through the primary care offices, there are not as many sort of colds and earaches and sore throats coming in. And that's because people are keeping their distance and certainly wearing the mask. We don't know as the weather changes, when you have to get more in sort of close quarters, what will happen then. But I think if you take those precautions, we should see less, I think, general sort of upper respiratory tract infections and general flus in the population, which is a good thing.
Mm-hmm. Definitely a good thing. Now, you said that we're doing very well with COVID cases right now. There are no cases in Thunder Bay. If someone does suspect that they do have COVID or they want to get tested, that has changed since in the last week or so, because it was the health unit before, but it's now being directed to the hospital.
Yes, the health unit has done an excellent job over the past sort of 5 to 6 months at the assessment center, but their staff have to get back to take care of the schools, take care of the contact tracing, and take care of sort of the restaurants and the public health difficulties out there. So that's why the hospital has been asked to take over the assessment center, and then we're still at the same location. You still have to call before coming in and making an appointment. but the numbers have skyrocketed since we've taken over. The average calls per day at the assessment center run by the health unit was about 200. We're receiving 1,000 calls a day now. So we were sort of overwhelmed over the weekend regarding all the calls, and the telephone lines actually were disrupted, and we had a few challenges, but I think we're back on board now. It's only taken about the average now 7 minutes to wait online, to wait on the phone to get your appointment. And now we do have a new online tool that you book online your appointment to at the assessment center.
So once you have an appointment, where is the testing taking place?
It's still being taken place in the trailers outside the emergency. We are just in the middle of sort of renovating a place right adjacent to the hospital that'll be more permanent, because we hard to be in the trailers when it's 30 below. So we're just renovating a place at 980, I think 980 Road, the professional building beside us, that people can drive in right at the parking lot and have the testing done there. We'll have more information probably by mid-September. That should be open, but for now it's still being taken place at the trailer.
And you don't need to have any symptoms. Anyone can get tested. You just need to make the phone call to make, or go online to make the appointment.
No, that's been the challenge regarding not having a testing strategy from the Ministry of Health. So right now, anybody can be tested, symptoms or no symptoms, travel or no travel. But we are coming out, so for now that's okay, but we need a provincial testing strategy that we expect over the next little while. I'm not encouraging asymptomatic people to get tested unless they're coming from a high-risk area, unless they're going to, seeing somebody in a long-term care home, unless they're traveling from the north or up into the north. But certainly because the prevalence is so little, I'm not sort of suggesting asymptomatic patients should get treated. We are doing our preoperative patients, but that probably is going to change too. So we're changing our standards. We're waiting for a provincial strategy, but we haven't got that yet. So at this point in time, anybody can get tested, but I encourage just more symptomatic patients or patients who've had a travel history should be tested.
My daughter just had some surgery done at the hospital and she was given a COVID test. And you're saying is that's happening right now, but that could change?
Well, it could change in some procedures. So if you have to be what we call intubated and the anesthesiologist is exposed to sort of an aerosol procedure, then we still prefer that to get tested. Mm-hmm. But if they're just having local surgery, hands or the feet, and they're not being put to sleep, that's probably going to change.
So let's talk about that a little bit. Is everything opened up at the hospital? Has things gone back to sort of normal?
Most have gone back to normal. We've had in some of our high specialty areas, like our operating room, our recovery room, and some of our specialty clinics, because human resources has been a challenge because summer holidays, we have to make sure we take care of our staff. They've taken their holidays. But as of September, we should be back to 100% capacity in everything. We're actually planning for sometime in October, once we get our human resources worked out, to go for a 7-day-a-week operation. So we're opening up to get to 120% capacity if we're able to have sufficient PPE supply, sufficient drugs, and sufficient personnel. So we need to catch up with our backlog, and that's one of our strategies.
Do you see the visitation or care partner situation changing anytime soon at the hospital?
We look at that almost every week. Right now we have our care partners that they can come from 5 till 8, one care partner per patient. We have sort of our essential sort of care partner there that they can be there from throughout the day. And at this point in time, because of the unknown about any type of second wave coming, because of the increased volume, because we're getting back up to normal operations, the increased outpatient volumes have increased to 100% too. There's more flow in the hospital. So at this point in time, we're not having any projected change anymore regarding the visitation policy. But we do review it, and we know we have to have sort of consideration for the family. But I must say, patient visitation, we have been too lax in previously. I mean, so from 8 o'clock in the morning to 8 or 9 o'clock at night, patients get tired. They need their rest. They don't need a family and friends dropping over any time during the day. They're here to recover. So we have to relook at our policy and look at more how we can, and we have looked at virtual care. So virtual care is a way to do it also, actually, now that we have access to that. So will we get back to visitations as it was prior to COVID? I can guarantee you one thing, no, we won't. We need to take special precautions.
Well, Dr. Kennedy, it's been a while since we spoke. Thank you so much for talking to me today. Is there anything else you want to say to the community?
No, I think, the community is still doing a remarkable job. And I think even going out in public, they really are respectful and taking the precautions. I mean, it's tough. It's difficult we're used to hugging, to being close, to sharing food. I mean, it's a big change for the public. And here in Thunder Bay, they've done remarkably well. And even with the visitors coming from down east, families coming from down east and out west, I think that is still occurring, and we're still in good shape from COVID. So from my perspective, I would just like to thank the community. We're doing a great job.
Well, Dr. Kennedy, thanks so much for talking with me today.
Thank you. Good seeing you again. Bye-bye.